So, what first sparked your interest in research?
Yeah, when I started my career in mental health, initially I was in a community mental health agency. I had my bachelor's degree and wanted to get my master's degree. And as part of that degree, I had to do a dissertation, like a master's level project, research project. And that was my first true interface with research. And I quickly realized that there's a lot of impact that can happen through research above and beyond sometimes even clinical work where you're doing work with one person one-on-one, whereas with research, you're doing a more macro level and, thinking about a whole population. And that got me really excited.
Most of the research that you've been doing recently is in the school setting. Uh, One of the projects that you've been involved in is training students to be peer counselors. What is the need for that? Why not just point students to trained therapists?
Sure. Yeah. So you're correct. A lot of my work recently has been in the school district here in our community in San Bernardino. And what I started learning from my research is that our current mental health system is not very efficient. So if you need to see someone, you have to, call the clinic, get your appointment. There's usually a wait list, and then it's 1 hour a week. And that's for the people who actually make the call. And with high schoolers especially, there is a little bit of reluctance or shyness or difficulty kind of taking that step. So the idea initially was to work with community health workers who are adults. So it's not really a peer-to-peer, but it's a non-specialized workforce or like an unlicensed workforce, which provides more access to people who have kind of low-level mental health needs. So we're not going to send someone with severe mental illness, right, to see a community health worker. And the model works really well. Loma Linda actually uses community health workers a lot in their medical settings and in mental health settings. So then I was thinking, well, what about a step further? And a grant came through with the school district to train actual high school students to become peer counselors for their own peers. And yes, we can point peers, students to see a therapist on campus, but sometimes they just want to talk to someone their age, and it can be that first barrier can be overcome by just talking to a peer, having someone that will listen to you, that comes from your neighborhood, understands what you've been through, is your age, and then the idea is for that peer to then point the student to a licensed provider, because we do want them to eventually get to that point.
What are the strategies that you train them in?
Mm-hmm. Before we even train them in any strategies, like actual mental health strategies, we do want to train them on good listening skills, communication skills, and confidentiality, most importantly, because they are peers with these students, right? So we want to make sure anything that's shared is kept confidential. And then thereafter, we have selected a few strategies that is also evidence-based, based on a lot of the research that I've done, and that has shown to be very commonly part of existing evidence-based prevention and intervention programs.
So, in the students that have received the training so far, what are some of the things that you're seeing them report?
Yes. I'll preface by saying I don't have actual data yet. We're in the process of doing all this. But just speaking to the students anecdotally, some of the students have actually showed up to conferences and spoken to large audiences of adults about their experience and have shared just how impactful it has been for them to connect with their school community, to feel like they have a role, and how it has really changed their trajectory. A lot of these students, especially at this particular high school, it's a continuation high school. It's for credit deficient students who may have, a number of issues going on in their lives. They have shared that they didn't even want to come to school. They were skipping class. They didn't care. And this program really gave them a reason to come to school, which then trickled into their academics. And it just has had a very impactful effect on their lives.
That is so cool, because I didn't know about the continuation school part, and the fact that these students are now showing up, have a purpose, have this feeling of, I want to be part of something and I get to actually exercise these skills. That's so cool. What do you hope is the impact on the wider world of psychology as a result of what you're doing, the research that you're doing?
Yeah, I think it's important as a field for us to come to terms with the fact that our current system is not very efficient, as I mentioned earlier. Currently, if you want to see a licensed therapist, they will have gone through 5 to 7 years minimum, some of them more, right, to get their license. And that creates a bottleneck. We have many, many parts of our country and around the world where there's simply not enough providers to meet the mental health need. So when we think about training a workforce, a lay workforce, so whether that's students in a high school counseling their peers or community health workers in communities, in homes, supporting, people in their community, that training is more, 3 months to a year. So you're kind of relieving some of that bottleneck and increasing access to mental health services, at least at that kind of entry level or first responder. That's the hope, that we can relieve that bottleneck and increase acceptability of a lay workforce for mental health.
What would you say to a student who's listening who wants to make an impact on the world like you have through the research and the work that you've done?
Yeah, I would say that, first of all, not one person can change the world, right? We have to rely on each other and build off of each other's efforts. And I think Loma Linda is a wonderful place to do that kind of work. We have the Institute for Community Partnership here that can directly connect students with communities that want support, whether that's medical, mental health, dental, etc. There are lots of opportunities to serve. So reach out. Yes, we can help all over the country and all over the world, but we can help right here at home in our very own community and make an impact.